All right, welcome back everyone for another deep dive. Today we're going to be talking about COVID-19 vaccination rates in nursing homes.
Oh, a very important topic.
Yeah, and how they're affecting the health of nursing home residents.
Yeah.
So we're members of Herbal Bloom.
Yes.
And you can find the full article that this is based on at herbalbloom.org.
Absolutely.
But we're going to be diving deep into some CDC reports, some research studies and insights from healthcare professionals.
It's going to be fun. We're going beyond just the numbers, though, to really get into the nitty-gritty of what's going on.
Yeah, and I think a good place to start is with a statistic that the CDC released recently that kind of blew my mind.
Oh, really?
Yeah, only 10.5% of nursing home staff received the latest COVID-19 vaccine during this past season.
Wow.
Yeah, and to put that into perspective, the rate for acute care hospital staff was 15.3%.
That's a big difference.
Yeah, that's a huge difference.
Huge.
And it's a trend that's kind of hard to ignore.
Yeah, absolutely.
Especially when you consider influenza vaccination rates, too.
Yeah.
It's 45.4% for nursing home staff versus a whopping 80.7% in acute care settings.
It seems like something's going on here.
Yeah, something's definitely going on.
And it's worth digging into.
Yeah, so the CDC points to a few potential factors.
Okay.
One, those mandates requiring healthcare workers to be vaccinated have expired.
Yeah.
Also, now that COVID-19 vaccines are commercially available, access and costs might be playing a role.
Right, and there's always the misinformation out there.
Yeah.
Despite the evidence supporting vaccines, there are still concerns about their safety and effectiveness.
Among some healthcare personnel.
Yeah.
And it seems like those concerns and maybe even access aren't evenly distributed.
Oh, interesting.
A health affairs study found some really wild discrepancies in vaccination rates based on what shift you work.
Oh, wow.
Day shift was highest at 67%,
Okay.
followed by evening shift at 62%. But the night shift folks lagged way behind at only 50%.
That's fascinating.
What do you make of that?
Well, it suggests that there could be some structural issues at play within nursing homes.
Okay.
Think about it, evening and night shifts often have less face time with leadership.
Mm-hmm.
Maybe that means there's less emphasis on vaccination.
Less emphasis on vaccination and health protocols in general.
Exactly.
Oh, like an out of sight, out of mind kind of thing.
Yeah, less visibility from the higher-ups could mean that vaccination just isn't top of mind.
Yeah, that makes sense.
And this also ties into another layer of complexity, which is racial disparities.
Oh.
The same study found that Black employees were overrepresented on night shifts.
Interesting.
And guess what? They also had lower vaccination rates overall.
Wow, so that points to a connection between work structures and access to information.
Yeah, and unfortunately, systemic biases.
Wow, that's a lot to unpack.
It is.
It really makes you think.
Mm-hmm.
But maybe let's shift gears a bit and explore some other ways to protect nursing home residents.
Okay.
Even beyond vaccination.
Yeah.
Some researchers in Nature found some really cool stuff about identifying those most at risk, even if they are vaccinated.
Oh, wow.
So they've been looking at something called immunovirological profiling.
That sounds very complex.
It does sound complex.
But it's actually a very targeted approach.
Ah.
You can take a tiny sample from someone's nasal passages and analyze it to see how their body is likely to respond to the virus.
So it's like a personalized risk assessment almost, like
Yeah.
peeking into the future of their immune response.
Precisely.
Okay.
And one of the key indicators they found was something called interferon beta, or IFNB1.
Mm-hmm.
And if that level is high, it could be a red flag even if the person is vaccinated.
So that's like an early warning system for who might need extra protection, even with the vaccine?
Yeah, exactly.
That's amazing.
It's all about layering those protective measures.
Yeah.
And speaking of layers, the Nature studies also highlighted the critical role of environmental monitoring in nursing homes. So the virus can linger in the air for a surprisingly long time, up to 52 days after the initial infection.
Wait, 52 days? That's almost 2 months.
Yeah.
So even if someone recovers, the virus could still be hanging around
Exactly.
and potentially infecting others.
Mm-hmm. And that's where regular air quality sampling and viral detection in common areas become so important.
Yeah, it's like having a radar system that can pinpoint potential hotspots
Yeah.
and help nursing homes take swift action to prevent further spread.
Exactly.
So we've got vaccination, we've got personalized risk assessment with this immunovirological profiling,
Right.
and now environmental monitoring. It's starting to sound like a pretty robust defense system.
It is.
But I know a lot of people are still worried about vaccine safety,
Yeah, especially when it comes to this population.
especially when it comes to this already vulnerable population. Yeah, I mean, it's completely understandable.
It is.
But there is some reassuring news.
Okay.
A study in JMDA looked at the risk of death after vaccination in Dutch nursing homes. And they found that the risk of dying within 30 days of getting vaccinated was actually much lower than historical data from before the pandemic.
So not only are the vaccines safe, but they're actually providing an extra layer of protection against death for these residents.
Yeah, it sounds like it.
That's pretty remarkable.
It is remarkable. But, it's important to remember that we're not just talking about physical health here.
That's a good point.
The well-being of the staff is absolutely crucial.
Absolutely.
And that's where things get a bit more complicated.
Yeah.
You're talking about that Science Direct study on how nurses' working conditions affect their confidence in vaccines, right?
Yes, it's a powerful study, for sure.
That one really made me think.
They surveyed thousands of nurses in France, and they found that dissatisfaction with working conditions was strongly linked to lower trust in health authorities. And that lack of trust directly impacted their confidence in vaccines.
Wow.
Both for themselves and their patients.
So if nurses are feeling burnt out, undervalued, and unsupported, they're less likely to buy into the whole vaccination message.
Right.
It makes sense, but it's pretty concerning.
It is concerning, and it's not just about personal opinions. It has real-world consequences.
Right.
The study found that nurses who were unhappy with their work were less likely to recommend both flu and COVID-19 vaccines to their patients,
Yeah.
which could directly contribute to lower vaccination rates overall.
It's a stark reminder that we can't separate physical health from mental and emotional well-being.
Yeah, especially in a high-stress environment like a nursing home.
Absolutely. And that brings us to the critical question.
Okay.
How do we improve vaccination rates in these settings?
Yeah, it's a multifaceted challenge.
It is. A PubMed study highlighted some promising strategies like incentives, educational programs, and what they called vaccine champions.
Oh, those champions are a great idea.
Yeah.
They're basically individuals within the nursing home, often nurses themselves, who are passionate about vaccination, and they take on this role of advocate, sharing information, building trust with their colleagues and residents.
It's peer-to-peer education, which can be incredibly powerful.
Absolutely. People are more likely to listen to and trust someone they know and respect.
Right.
And that's where I think we need to shift our focus of building trust, fostering open communication, and creating a culture where everyone feels valued and empowered to make informed decisions about their health.
Well said. We've covered a lot of ground already, from those alarmingly low vaccination rates to the factors driving them. And now we're starting to delve into potential solutions.
It's a good start.
It is a good start, but hold on tight, because there's much more to explore in this deep dive.
Oh.
We'll be right back
Okay.
after a quick break.
Sounds good.
It's really striking how this all circles back to the human element. We can talk about statistics and scientific advancements all day long, but at the end of the day, it's the people on the ground, the nurses, the staff, the residents who are at the heart of this issue.
Yeah, and their experiences, their concerns, their level of trust, all of that plays a huge role in whether these protective measures we've talked about are actually effective.
Right. We can't just throw science at the problem
Mm-hmm.
and expect it to magically disappear.
Right.
We need to consider the human side of things, too. And speaking of which, that reminds me of the article from Herbal Bloom that sparked this whole deep dive.
Yes, that's right.
That's a really interesting piece.
It offers a unique perspective on how to approach this complex problem from a more holistic standpoint.
Absolutely. And as members of Herbal Bloom,
Yeah.
we're always interested in approaches that consider the whole person, not just their physical symptoms.
Right, exactly. And the article highlights a specific herbal and nutritional formula designed to support overall well-being and resilience.
Especially in the face of challenges like COVID-19.
Yeah, and what I find fascinating is that it blends traditional wisdom with modern scientific understanding.
I love that.
Yeah, it's like taking the best of both worlds and combining them into something truly powerful.
So let's dive into some specifics. The formula features ingredients like Nigella sativa, also known as black seed, which has been used for centuries in traditional medicine for its antiviral and anti-inflammatory properties.
Black seed, that's fascinating.
I've heard of it, but I didn't know about the antiviral properties.
Yeah.
What else is in this formula?
Well, there are also adaptogens like ashwagandha
Okay.
and reishi mushroom.
Mm-hmm.
These are amazing for helping the body cope with stress and promoting balance. They're like little superheroes that help your body adapt to whatever life throws at it.
Superheroes, I love that.
Yeah.
What about those essential nutrients we always hear about? are those included too?
Absolutely. You've got vitamin D3, omega-3 fatty acids, and magnesium all playing a vital role in supporting immune function, reducing inflammation, and even addressing some of those lingering fatigue and cognitive issues people experience after having COVID-19.
So it's like a multi-pronged approach to building resilience, not just physically, but also mentally and emotionally.
Yeah.
And that aligns perfectly with what we've been talking about, right?
Exactly.
Addressing the human factor in this whole equation.
It's about supporting the well-being of everyone involved, from the residents to the staff.
Mm-hmm.
Because when people feel better physically, mentally, emotionally, they're more likely to be open to information, make healthier choices, and advocate for their own health and the health of those around them.
It's like creating a ripple effect of positive change. You start by supporting individuals, and that ripples outward to their families, their communities, and ultimately the entire system.
I couldn't agree more, and it really speaks to the mission of Herbal Bloom, which is to empower people with the knowledge and resources they need to take control of their health and well-being.
Empowerment, that's the key word.
Yeah.
We're not just talking about handing out pills or giving orders.
Right.
We're talking about giving people the tools they need to make informed decisions and advocate for themselves.
Absolutely, and that empowerment is essential if we're going to navigate the complexities of this pandemic and ensure we're protecting those who are most vulnerable.
But let's not forget about those low vaccination rates among nursing home staff.
Right.
We've explored some of the reasons behind those numbers, but I'm still wondering, what can we actually do to improve them? What concrete steps can we take?
Well, that PubMed study we talked about offered some great starting points, like those incentives, educational programs, and the vaccine champion concept.
Right. Those are all solid strategies. But I wonder if there's more we can do to address the root causes of vaccine hesitancy, like those difficult working conditions we discussed earlier.
Yeah, you're hitting on a really crucial point. If nurses are feeling overworked, undervalued, and unsupported, it's no wonder they might be distrustful of information coming from health authorities. We need to create a culture of respect and appreciation for these frontline healthcare workers.
Yeah, it's about more than just saying thank you, right?
Absolutely.
We need to see real change policies that improve working conditions, reduce burnout, and ensure that nurses feel heard and valued.
It's about creating an environment where they feel empowered to make informed decisions about their own health and the health of their patients, and that empowerment starts with addressing their needs and concerns.
This has been such a fascinating and insightful conversation so far. We've covered so much ground, from alarming statistics to groundbreaking research to potential solutions. But I think you've hit the nail on the head. It all comes back to that human element.
Absolutely. We can't forget about the people at the heart of this issue, and I think that leads perfectly into my final thought for our listeners as we wrap up this deep dive.
Ooh, I love a good cliffhanger.
Given everything we've learned about the complexities of this issue, the challenges faced by nursing home staff, and the importance of addressing those challenges to improve vaccination rates, the question we need to ask ourselves is this: how can we best support nursing home staff to ensure they feel valued, informed, and empowered to protect themselves and their residents?
Wow, that is a powerful question, and it's a question that deserves a thoughtful and compassionate response. Thank you for joining us on this incredible deep dive.
Yeah.
We hope you found it informative and thought-provoking. And as members of Herbal Bloom, we encourage you to visit herbalbloom.org to read the full article and explore more resources on this important topic.
It's been a pleasure diving deep with you all today.
It's a call to action, right? We can't just sit back and hope things get better. We have to actively work towards creating a more supportive and empowering environment for these frontline workers.
Yeah, it's about fostering that culture of collaboration and respect where everyone feels like they're part of the solution. We need to move away from this us versus them mentality, healthcare workers versus patients, administrators versus staff, and recognize that we're all in this together.
We keep hitting on this idea of togetherness, and I think that's so crucial if we want to create real change. It can't just be top-down. It has to be a collective effort, and that starts with listening.
Yes.
Really listening to the concerns of nursing home staff, understanding their day-to-day challenges, and then working together to find solutions.
Open and honest communication is essential. We need to create a space where everyone feels safe to share their perspectives and ideas without fear of judgment or reprisal.
It's about fostering that sense of trust, isn't it? Because when people feel heard and understood, they're more likely to be receptive to new information, more willing to embrace change, and more likely to trust the recommendations of health authorities.
Exactly. And that trust is the bedrock of any successful vaccination effort. It's not about forcing people to get vaccinated. It's about creating an environment where they feel confident in making informed decisions about their own health and the health of those they care for.
So informed decision-making, that's the goal. And that's where initiatives like those vaccine champions we discussed earlier can be so impactful, right?
Yes,
They
absolutely.
can bridge that gap between health authorities and nursing home staff,
Mm.
providing information in a way that's relatable and trustworthy.
They're like ambassadors, building bridges and fostering understanding, and they can also advocate for their colleagues' needs, ensuring that their voices are heard and their concerns are addressed.
I love that imagery of building bridges.
Yeah.
It really captures the essence of what we're talking about.
Hmm.
Creating connections, fostering trust, and working together to find solutions that benefit everyone.
It's about building a network of support, a community of individuals who are committed to protecting the most vulnerable among us.
Because ultimately, that's what this all boils down to. Protecting those who are most at risk,
Mm.
whether they're nursing home residents or staff members,
Yeah.
or even members of our own families.
Exactly. And that protection comes from a multifaceted approach. Vaccination is a key piece of the puzzle, but we also need those additional layers. We talked about immunovirological profiling, environmental monitoring, and of course, supporting the overall well-being of both residents and staff.
Right, it's not a one-size-fits-all solution.
No.
We need to be adaptable, innovative, and willing to explore new approaches as we continue to navigate this evolving pandemic.
Absolutely. And most importantly, we need to approach this challenge with compassion, empathy, and a deep commitment to protecting the health and well-being of everyone in our communities.
That's such a powerful message to end on. Thank you so much for sharing your expertise and insights with us today. This has been an incredibly informative and inspiring deep dive.
It's been a pleasure.
And to our listeners, thank you for joining us on this journey. We hope you found this conversation as thought-provoking as we did. Remember, the conversation doesn't end here. We encourage you to keep exploring this topic, keep asking questions, and keep advocating for solutions that prioritize the health and well-being of all. And for those of you interested in learning more about the herbal and nutritional formula we discussed and other resources for supporting your overall health and resilience, be sure to visit herbalbloom.org. Until next time, stay curious, stay informed, and stay well.